Hi, I'm Dr. Mayberry. We are continuing our discussion of the vertebral column. These are going to be the thoracic vertebrae that we were talking about here. So the landmarks are very similar to the ones that you need to know for your cervical and your lumbar vertebrae. So again, the vertebral column looks like a lot, but it's actually much less than the upper and lower limb and even the skull will be. So here we have thoracic vertebrae. Thoracic, think thorax. These are the vertebrae that your ribs are articulating with. So everyone has 12 pair of ribs, so everyone has 12 thoracic vertebrae. Which means that the unique thing about the thoracic vertebrae are that they have these costal facets. So costal is always in reference to the ribs. So whereas on the cervical vertebrae you looked for the transverse foramina, on the thoracic vertebrae you're actually going to look for costal facets. And if it has a costal facet, it's a thoracic vertebrae. I should add that there can be exceptions. I've seen people with cervical ribs, but it's pretty rare. So you can consider the rule for this class: if it has a costal facet, it is a thoracic vertebrae, and there should be 12 of them, and there should be 12 ribs. So, thoracic vertebrae. Much longer spinous process than we saw with the cervical vertebrae, and much longer spinous process than we'll see with the lumbar vertebrae. So, that is also another way to recognize the thoracic vertebrae. And the transverse processes, they have these costal facets on them that I'll show you in a second, but that means that they stick out very differently from the transverse processes in the cervical and lumbar vertebrae. Okay, so body, still the body. Vertebral foramen, still the vertebral foramen. Vertebral arch, it's different, right? It looks different than it looked in the cervical vertebrae, but it's still the vertebral arch. We have these superior articular facets on top. We have inferior articular facets down here. So you would be looking like this if you're looking at the back of the person. They are right in there. And these are the costal facets right on the back, or really on the front, on the anterior side if we're referencing anatomical position, of the transverse process. So I showed you in the cervical vertebrae that the vertebrae are transitionary. And so here, hopefully you can see that there is a gradual transition in shape and morphology into lumbar vertebrae. So again, they're not all identical. You actually can differentiate between T1, T2, T3, all the way to T12. Remember, there are 12 thoracic vertebrae. So let me check my list very quickly and make sure that I have all of your landmarks before I let you go. It looks like I do. So I will meet you at the lumbar vertebrae video.